Dear ladies and gentlemen, dear participants, dear Professor Ayadi, it is my distinguished pleasure to welcome you all on behalf of the regional program Political Dialogue South Mediterranean of the Konrad-Adenauer-Stiftung based in Tunis to our online seminar entitled The Impact of COVID-19 on the South Med region, co-hosted and co-organized with the Euro-Mediterranean Economists Association and her president, Professor Rym Ayadi. The Euro-Mediterranean Economists Association conducted a study in the past weeks and months to analyze the health sector resilience and the socio-economic consequences of COVID-19, with a particular focus on Morocco, Algeria, Tunisia, Palestine, Lebanon, and Jordan. Obviously, this global pandemic has severe impacts on our daily lives, on the health sector, on civil-state relations to some extent, and on the economy in general. And in a recently conducted regional survey on our behalf, which we will publish in January next year, on the views of the Arab public a decade after the so-called Arab Spring, we also asked about COVID-19 and the socio-economic impact these days. And one interesting outcome of this study was that a vast majority of those surveyed said that the COVID-19 outbreak in their respective country is very or somewhat serious, including 92% in Lebanon, 86% in Tunisia, and 82% in Morocco. What is striking is that in all countries surveyed, at least 6 in 10 are very or somewhat worried that the pandemic will have a negative economic outcome at the respective national level. And levels of concern about COVID-19, including its health and economic implications, are, according to our survey, strongly linked with perceptions about how the government in the respective country is handling the crisis. The percentage of those who say the government is doing a good or very good job is just 18% in Lebanon and, for example, 15% only in Tunisia. So this is a survey, as mentioned, that will be published soon, but today at the core is to see and to get to know more how the health sector resilience actually can be described in the respective 6 countries mentioned before, and how preparedness of the health sector is characterized and which socio-economic consequences are already seen. And I could not think of someone more competent to do so and present us the results than Professor Rym Ayadi, the president of the Euro-Mediterranean Economic Association. She conducted this survey and she will speak with us about the main results when it comes to the health sector resilience and possible socioeconomic consequences. I'm very glad that she accepted our invitation today, and without any further ado, the floor, or better the screen, is yours, Professor Ayadi.
Good morning, everybody. I'm very pleased to be with you today to present the result of this survey that we have developed, which is in fact part of a much larger initiative, which is the Euro-Mediterranean Economists Association COVID-19 Policy Research Initiative, which we launched in March 2020. So I will share my screen to share with you the results of this study, which is, as I mentioned, part of a much larger So do you see the screen, Thomas, or not yet?
Not yet.
Okay, let me try
now.
now.
Yeah, now it's good.
Okay, so, okay, as I mentioned, we had the pleasure to collaborate with the Konrad-Adenauer-Stiftung in Tunis to conduct this study, which is mainly focusing on the resilience or the factors of resilience of the healthcare systems in the Mediterranean during the COVID-19 pandemic. So we focused mainly on the cases of Algeria, Jordan, Lebanon, Morocco, Palestine, and Tunisia. We have done a more comprehensive assessment for all other region or countries in the East Mediterranean, East and South Mediterranean region, but also in Africa. And we have all this information, of course, not exactly this study, but it's on our website, which is publicly accessible. So let me focus in the next couple of minutes. I think I have 15 minutes. Correct me if I'm wrong, Thomas. 15 minutes to present.
Exactly, 50 minutes would be great.
Exactly. So we'll share with you the main assessments we did. And then obviously we have to continue monitoring the situation because obviously the crisis, the health crisis is not yet unfolding. So it's still ongoing. Now, our study mainly investigates the evolution of the pandemic in these countries, I mentioned, as you see them in front, and then the policy responses and the socioeconomic preparedness of these countries. We try to put a zoom on the healthcare systems in these target countries, and we apply, in fact, the framework which I have developed a couple of months ago, which I call the 3-pillar system for resilience. So this is a system which is mutually interactive and which is based on 3 key dimensions. First, the early warning system, which is the capacity of the healthcare sector to detect pandemics in advance and to be ready to respond in case of large-scale infections. In fact, this is what we call a system that can be applicable where there is any exogenous risk. And in fact, the pandemic is an exogenous risk which has materialized. The second pillar is how the system is managing the crisis and how the system is managing this risk. And it, in fact, builds on this early warning system because we need to have the information. And also it activates the healthcare policies to combat the health crisis. But this is not in isolation. It has to be made in close collaboration with all the socio-economic system of a country. Because you need, in fact, money and funds to be able to activate this response. And the third pillar is the crisis recovery system, which is the activation of a medium to long-term investment and overall policy plan to ensure recovery from the healthcare sector, healthcare crisis. Because in reality, during a crisis, there are costs that materialize. And then you need to recover and to jump into a system which can function, and it will be also ready for other crises should they occur in the future. So it's really a system which help our preparedness, our socioeconomic preparedness overall. And then on this specific instance, we are applying it to the healthcare sector, and it could be applicable to any other sector over time. Now, as you see here in this slide, this is the cumulative COVID-19 cases since the beginning, since the February 2020 in the region that we are talking about, in those 6 countries that we assessed here. And you can see clearly that there is an increase of the infection cases over time. So if we look at the stages, At the initial stage of the pandemic, March, April 2020, the target countries that we are talking about, these are Algeria, Jordan, Lebanon, Morocco, Palestine, and Tunisia, presented low level of infection, in fact. But at the same time, testing has been extremely low also. I think this is also something that needs to be carefully considered when we assess these numbers of infections and so on. Now, we try to compare to Europe because Europe, specifically Italy, Spain, and France, have been very hardly hit by the pandemic. So we always try to make this comparison to see really how other countries have fared during this pandemic. Now, governments worldwide in reality have opted for containment measures, which you can see the line, the vertical line, since March, which were introduced rather quickly in these 6 countries to avoid, in fact, a likely collapse of these precarious, what we call precarious, healthcare systems. And I will explain why I'm saying they are precarious. Now, after the first wave of the pandemic, which is March, April, targeted countries, they started, because you see, as you could see here, the infection level was rather low. So they started to ease the containment measures between May and June. After this lifting of the containment measures, cases increased again, as you can see in the graph. And again, countries have reintroduced other targeted containment measures, including curfews and lockdown since mid-July. But in reality, the infection rate has increased, as you can see in this graph. So really, this pandemic, it's a very uncertain, I would say, it has very uncertain outcomes, and it is very difficult to know at which specific timing and what is the specific intensity level of the lockdowns and the policy answers in terms of containment should be put in place. Now, in terms of the socio-economic preparedness, which in fact this is overall, so where the countries under investigations prepared socio-economically to face such a pandemic, and here we created a very simple indicator based on a bunch of indicators, socio-economic indicators on all the methodology. You can see it easily on our website. So overall, we show that, as you can see, all of them are on the negative side, very low preparedness scores in Lebanon, Palestine, and Tunisia. Why is that? It's because of low fiscal space, very high social vulnerability, plus lack of sufficient precautionary saving buffers. So this is extremely important. What I call these are key pillars for the preparedness of the countries to be on the high end. Now, we also looked at beyond those, because this is really the overall indicator. I mean, of course, this indicator takes into account economic factors, social factors, financial monetary factors, and so on, and also institutional factors. For example, if we look at the case of Jordan, Jordan has shown that it has quite of a high quality of institutions and relatively lower level of corruption and quite a strict rule of law. Now in Algeria, if you can see Algeria, they have in fact a positive preparedness index, 27 there. They showed really a favorable socioeconomic conditions and also in a way an inward looking profitable banking sector. So, but again, this country, Algeria, has a lot of resources, most probably accumulated from the oil reserves and so on. But then, of course, during the pandemic, this has changed. And most probably, this picture would be different next year. So that's why I said from at the beginning of my speech, it's important to continue monitoring over time. Now, if we look at Morocco, although the numbers are rather, I would say, you see 5, but still on the positive end, it stands out. In fact, it performs much better in the countries that we are investigating. Now, in terms of the policy answers or the policy responses, all the governments responded based on their capacity, okay? So, of course, these, as I mentioned, countries that have very low fiscal space, high social vulnerabilities, and lack of buffers, I would say. And buffers are important. Why? Because they help the country to face pandemics or to face any other exogenous risks. Overall, if we look at the policy responses and we compare it to other countries, like in Europe, for example, the responses in these countries have been rather weak, which is explainable. Now, the main policy responses that we've seen are credit enhancement measures, state guarantees on new loan issuance, measures to smooth out the fall in income, helping to a certain extent the vulnerable populations. And also central banks, they have tried to cut the policy rates, except for some countries like in Lebanon and Palestine. And of course, in case of Lebanon and Palestine, we know what happened in Lebanon and in Palestine. The country is suffering from other, what I call political issues and other difficulties because of the conflict. Now, also, there has been some fiscal stimulus, but then again, and I repeat, the space for these countries to spend is very low. And we can see that all these countries have very high indebtedness rates. Obviously, high indebtedness reduces the capacity of these countries to spend when there is a crisis. Now, if they spend more domestically, then it's possible. But then this will have certain implications in the future. Now, if they indebt externally, then it comes at the expense of their external, external debt position. And that is why, in reality, nowadays, many countries have asked for debt relief. But these are mainly African countries, and most probably some countries, other countries will have to go into the same direction. Now, the socio-economic key consideration and main consequences, again, it's very early to assess the magnitude of the detriment and the magnitude of the implications of COVID-19 pandemic. Next year, 2021, will be a key year to really understand what is the damage created during this pandemic. But based on the information that we could collect from the international organizations, for example, IMF, World Bank, International Labour Organizations, and so on, it is clear that poverty and inequality have increased dramatically. If we look at the poverty headcount ratios in Algeria, it's still low, but then the data, we need to see the data for end 2020 and 2021. But then we're talking about 5.5%, Morocco 4.8%, Tunisia 14.4%, Jordan 15.2%, Lebanon 27.4%, and Palestine 29.2%. And these numbers are bound to increase. Now, inequality has already been high before, and now it's going to increase again. If we look at the Gini index, 27.6 in Algeria, which is pretty much the lowest, and then to almost 40% in Morocco, which is the highest. Again, the pressure on poverty and inequality is extremely high, and it will only, as I mentioned, probably increase. Now, the second problem we see is the lack of social protection and persistent unemployment and informal employment. These are all aspects which have been exacerbated during the COVID-19 pandemic. So if we look at the percentage of population covered by some sort of social safety net programs, it is rather low. And I think this needs to be very seriously addressed in the next years to ensure that these numbers are I would say, controlled. Again, high unemployment, specifically among the youth and the women, has increased, and it is increased, in fact, even before the pandemic. But then if we look at the estimation of the International Labour Organization 2020, it is clear that the Arab countries, I mean, these are, you know, all the Arab countries will be losing 10.3% of the working hours, equivalent to 6 million full-time workers, which is quite high. And again, as I mentioned, this is only up to the second quarter of 2020. So if we consolidate all this data, we will know a better picture by the end of this year up to next year. Now, the very high level of informal employment in North Africa, the ILO is estimating with data 2018 up to 68.6%, and the Arab states 67.3%, which is really on the high end. Now, another issue which is really very worrying, and it has been also exacerbated during the pandemic, is the high food insecurity risk, and also other issues related to the migration that we experienced before. Because in fact, there has been a decline in remittances, and the data by the World Bank shows clearly that this is extremely dangerous for the countries that are heavily reliant on this source of income, which is remittances. For example, Jordan, 10.2% of its GDP, Lebanon, 12.7% of GDP, and then Palestine, 16.3% of GDP. So this is important to keep in mind that the loss of remittances will also continue exacerbating this problem. In terms of insecurity, food insecurity, I mean, many of these countries that we are investigating have high reliance on import of food, which was very much compromised because of the decline of I would say, the disruptions, in fact, of the value chains during the pandemic. And also the countries that are relying on export of their oil have seen their revenues decreasing. And this is really quite an important factor which needs to be carefully assessed, because then this might push up to 1.9 million people into malnourishment. Now, let me zoom on the healthcare sector. Now, our main question was, were the healthcare sectors prepared for such a pandemic? Globally, in reality, the healthcare sectors were not prepared. So if we look at the average world score, which is the Global Health Security Index score, which is created by the international organization WHO, this average world score was 40.2% in 2019, which indicates clearly that the world was not prepared to face such a pandemic. Now, our region, the countries that we have investigated, the scores, particularly as you can see the table in Jordan, Lebanon, Morocco, they are above this world average, but it doesn't mean that they are highly performing. They are very close to the global average. And then Algeria and Tunisia, it's quite low, as you can see here. I mean, the lowest is Algeria, and then followed by Tunisia. So obviously this a global health security index takes into account many sub-dimensions. And if you are interested to look at all the sub-dimensions, the information is open access on our website, which we on the regional monitor. Now, looking at the universal health coverage, which is a key target for the Sustainable Development Goal. The coverage of essential health service is rather, say, medium, could also be high in all the countries. 77.8% in 77.8 in Algeria, 75.7 in Jordan. All of them quite, they have, you know, high health service coverage. Tunisia 69.6%. And I think this indicator, it ranges from 0 to 100. So no data for Palestine. And this is based on data of 2017. Okay, so it would be interesting to see right after the pandemic whether these numbers have increased or decreased or maintained. Now, also, if we look at this aspect, there is high incidence of catastrophic, what we call expenditures. These are out-of-pocket health spending, which is exceeding 10% of the household budget, which is rather high in these countries. Tunisia 18.4%, Lebanon 44.9%, Morocco 22%, and Jordan is the lowest, which is fine, 1.7%. Now, if we look at the composition of the healthcare systems, they are mainly public, with an increasing private sector prevalence. Of course, in these countries, many population remains, or a large part of the population remains excluded from the health care system. And overall, in all these countries, there is an overall absence of early warning mechanisms to detect. And I think this has been clearly the the rule in these countries. Now,
May I ask you to sum up, maybe?
Yes. Okay. So
very interesting, but we should
so
have
this we talked yes. So this is I talked about it. So as I said, all these countries try to respond to this crisis, but then really with reactive emergency crisis management policies based on an unprepared sector. So what they have tried to do in reality is to expand the national supplies of PPEs, and then also through either domestic production or import, and then try to find and build new facilities for COVID-19 patients, increasing the number of medical staff and so on. So all of them tried to react fast, and also tried over time to increase their testing capacity, but then the two countries that have done this is Jordan and Lebanon, and the others, the other countries, generally testing has been quite low. Now, in terms of the crisis recovery systems, they try to implement measures and intervention plans with a short term, as I mentioned, emergency approach. But then at the same time, a few countries had some medium to long-term initiatives toward recovery. Okay, so these are Algeria, Tunisia, and Morocco. So I'm going fast to go very quickly to the conclusions, right? And then, in fact, also what is good news is there were very many international engagements to respond to this crisis and help these countries collectively, Europe, IMF, World Bank, UN, and so on. And this has been quite an important important action from the international community. Now, just to conclude, based on my assessment, First of all, it's really important that countries establish an early warning capability system. So this is important to detect and so on, and to explain, and I can explain later on what it means in practice. Now, also it's important to reinforce the crisis management capabilities and to coordinate as much as possible with all the other economic institutions beyond the health, the ministries of health and so on. And then obviously build recovery capabilities over time. Obviously, we need to move into a more medium to long-term plans, aiming to enhance those capabilities. So it's a really long-term endeavor, which needs to focus on these bullet points. So more public spending for healthcare to reduce out-of-the-pocket expenditures, reducing the private-public gap, that's extremely important too, and trying also to find systematic mechanism to include the private healthcare sector when there is emergency situation. Also to reduce the rural and urban gap in terms of the healthcare service provision, increasing as much as possible the social protection coverage, increasing cooperation with neighborhood countries and learn from each other. I think that we have many experiences to learn from the neighbors, and also enhance the coordination among international organizations. So this is all, sorry for being a bit expansive, but this is, we took a few months to do this research, and I think there is a lot to say. Thank you very much, Thomas.
Thank you. Thank you very much, Professor Rym Ayadi. This is a very interesting study. I think we will have also the opportunity later in the Q&A section to go further in this study. We would like to first open now the discussion to the top panelists that are with us today, that will provide an overview and update of the potential impact of the COVID-19 on the economy, and also on the health sector in the MENA region. So I'd like to introduce Ms. Alia Boubayek, who is the founder of the Association of Women Economists across the Middle East and North Africa. Ms. Alia Boubayek is an experienced economist and policy practitioner and a strategist with more than 25 years of experience in government, international financial institutions, financial markets, and think tanks. She assumed research, policy, and management responsibilities in the design and implementation of economic and financial sector reforms covering the Middle East and North Africa. And she's currently chief economist of the MENA region and the investment bank based in London. Ms. Alia, what can we expect in terms of economy? What is the economic impact of the coronavirus in the MENA region? And also, talking about the study that that Professor Ayadi just presented.
Sure. First of all, thank you very much for inviting me. And I was very keen to join even at a short notice and to hear Professor Ayadi's study, which is of paramount importance and at this juncture in both for the economies and the societies of the Middle East. I think it is very important to highlight that the picture that Dr. Ayadi has explained stems, particularly in terms of the socio-economic impact, highly reflect a severe deterioration in the overall macroeconomic outlook of the MENA regions, and in particular the countries of North Africa and the Levant. After all, these countries have been subject to a dual shock, the shock of COVID, but also, let's not forget, a couple of them, at least in the region, whether Algeria or Iraq, are either oil producer or also depend on the flows of remittances and FDI and aid coming from oil exporting countries in the Gulf. And so it was also a double shock. The second shock is related to the oil prices, which directly or indirectly affected these countries. And this shock, of course, has seen the growth in many of these countries contract quite significantly. And for the first time of history, much. I mean, I recall in the financial, during the global financial crisis in 2008, obviously the region was impacted because of the spillovers of what's happening in the global economy, but still, we still had positive growth across the region. The only country today that has positive growth is Egypt at around 3.3 to 3.5% growth. All the other countries are contracting. The Arab world per se is contracting, growth is contracting by -5%. In the Levant, Iraq by -12, Lebanon -25, but I think it's a very specific case because we are in a financial crisis. I'm Lebanese and I'm sitting in Lebanon at present. Jordan -5, but even in North Africa, I mean, Tunisia, we are talking about a contraction of 7% growth, the same in Morocco. In Algeria, -6. So only Egypt is really growing in our region. And this growth is very much under what is required to absorb the high level of new entrants into the labor market. So the growth angle, the extent of the contraction of economy is a main driver of these poverty and inequality outcomes that we are seeing worsening, and that I agree 2021 will reveal a much worse picture. It is I think obvious for everybody why this contraction is so severe. Most of the countries in the region depend on sectors that are related to tourism-related services, tourism and travel, to the movement of people, therefore. But also a lot of the growth is driven by the inflow of remittances, which have dampened over time since the beginning of the year. But also we have seen a very sharp contraction in foreign direct investment. I mean, in non-GCC countries in the region, FDI for the first 9 months of the year have declined from more than 10 billion to less than 5 billion. So, and even less. So they've contracted by a significant amount. So these are factors that are affecting growth. And obviously, when you have growth contracting, you have the both the external and the fiscal deficits of these countries worsening. As Dr. Ayadi mentioned, countries now have to not only to try and use the fiscal lever to mitigate the impact of the contracting growth, but also continue on spending to contain the impact on the health sector and the other parts of the economy. So we have seen across the region a widening of the fiscal deficit, as we have seen across the whole world. But this is happening against an environment of a limited fiscal space, as Dr. Ayadi said, but also a deterioration in the sustainability of public finances in many of these countries. Now, obviously, Lebanon is an outlier because it has defaulted on its debt just before the COVID crisis, and is in a full-blown banking and debt and currency crisis with hyperinflation. That is, and the government, even though it is spending, but it's printing money, and that is really sort of contributing to higher inflation, erosion of the livelihood of people in Lebanon. And I mean, just maybe to update Dr. Ayadi's number on the latest estimate from the World Bank, is that poverty is actually moving from 29%, the number that you've mentioned in 2019, to more than 50% now in Lebanon. But this is not only COVID, this is also the multiplication of crises that Lebanon, and let's not forget, of course, the huge criminal explosion at the port since August, which has aggravated the situation. But the fiscal space is really stretched across those countries. And I think those countries that are being able to deal with it, or those countries that have been able to mobilize a lot of funding, particularly with the help of the international community, or who have relatively easier access to international financial market. At the top of the list, obviously, is Egypt and Morocco. Egypt has an IMF, is under an SBA, an IMF program, and this has allowed it to attract a lot of portfolio and private sector debt flows that helped it ease the sharp fall in FDI. Morocco is I would say have a very robust policy framework like Egypt, even without an IMF program, but has the support and has expressed that it is willing to seek another precautionary lending line from the IMF. So the kind of support that allows this increase in spending and to mitigate the impact of the COVID is very much there. For Jordan also the same, because Jordan is under an IMF program. Tunisia has benefited from exceptional financing under the IMF, but finds itself now in a limbo because of the delay in negotiating a new IMF program, and that is of course adding to the economic and social stress in Tunisia. Now, obviously, this macro picture has also seen a very had a very heavy toll on the private sector, and so the unemployment figures have been quite shocking. In Jordan, I mean, unemployment is now at end of September 24% versus 19% at the beginning of 2020. In Morocco, the same. We have moved from 10% to 13%. Tunisia from 15 to 18. So we are seeing an increase in the formal unemployment numbers. But I would agree, of course, that with Dr. Ayadi, that the key problem that is causing the loss of livelihood and the increase is really the high level of informality and self-employment that is very much widespread in those countries. In Morocco, the World Bank estimates informal unemployment at 81%, in Egypt at 64%, Tunisia 54%. The same, you have self-employment, Morocco is at 50%, and those have been affected significantly, much more than those employees that are in informal employment or in self-employed, have seen themselves more severely hit by the COVID and the lockdowns than, for example, those who work for the public sector, etc., because their income earnings have shrank significantly. And I think it's very interesting to highlight, and I'll try to wrap up, some of the simulations that the World Bank has recently done on the extent of increase in poverty across the region. I think in its latest study in October, the World Bank had said that poverty incidence is likely to increase significantly, and the range of increase in the number of poor can be between 178 and 200 million people between this and next year across the Middle East. And that's a huge number that require, of course, ramping up the capacity of the governments to intervene, to refine their policy response at all levels, whether in terms of support to the private sector, whether of better targeting of and continue the expansion of the social safety net, or even by thinking how to ensure that these trade disruptions, particularly for countries like Morocco and Tunisia, who are very much embedded in the international basically trade network, is dampened through accelerated reforms that would increase productivity and help basically regional integration. So I think we have a huge agenda ahead of us for all these countries, and I think forums like this discussion and the study that Dr. Ayadi and the team have done will only help in improving the quality of the discussion and of the evidence-based policy making.
Thank you very much, Ms. Alia Boubayed. Thank you for this overview of the economy. And as I previously said, we will have the time we are trying to have the time to further discuss on all these issues. But before, we would like to go to our second panelist, Mr. Yassine Kalboussi, who is a member of the Executive Committee of the Tunisian Center for Public Health. He's a medical doctor with experience in public health projects management and communications and primary care. And we would like to ask Mr. Yassine, what is your overview of the crisis when it comes to health sector in the region?
Thank you so much. Yeah, I will try to not repeat the main points Dr. Ayadi already mentioned in her presentation, because there were like some overlap between the talking points. But I think the crisis comes to systems that are already weak. And here we are not only speaking about like a new emergent virus, but like in the recent years, in most of our countries, we cannot even have the prevalence, incidence, and estimation of like cancer, chronic disease, cardiovascular disease, which are like the main well-known disease. So when it comes to a new emerging virus, we could imagine that the situation would be worse. So this is one thing. So, and to add, so I think Dr. Ayadi already covered the current crisis impact on the health system. I would much more go what would be the collateral issues that we will have in the next probably months and years. One of them would be a fatigue and exhaustion of our health professional that we already started to see in our emergency rooms and departments. The countries already faced challenges in recruiting, deploying, retaining, and protecting the well-trained and motivated health professionals. But I think what made the situation worse is some mistakes made in the health, in the human resources management, especially in North Africa. I think there was a contrast between the motivational policies and actions put in place for health professionals in Europe with like increase in salaries and incentives. But like if I take the example of Tunisia, until now we have like most of the doctors who were recruited as short-term contract during the COVID crisis were not paid yet for their 7 months of salary. So you could see this context, and this also is presenting a motivation for these well-trained professionals to leave and to continue this phenomenon of leaving Tunisia or like North Africa countries to Europe. So especially that the only, I think, professionals that the visa and work permit process was not stopped in embassies is for healthcare professionals, and some indicators say that the process was already accelerated. So this is one impact on the human resources. The second impact, major impact, would be on patients. And I think all the discussion on the impact of COVID, the economic, health, tourism, I think we tend to forget patients. Like patients will face a growing backlog of the healthcare process because of inability or fear of high-risk patients to contact the disease. There was huge delays in the care of chronic diseases like diabetes and chronic disease management and cancer care. So, and other like infectious disease. As an example, like 80% of outpatient consultation for HIV patient did not take place in Tunisia. It's like more 50% of people living with type 2 diabetes in Algeria did not seek care for like 3 or 4 months. And we know from a medical perspective that this, in few months, we would like see more and more complication. We would have a huge health impact, but also direct and indirect economic impact. So these are, for me, patients and healthcare professionals would also have a huge collateral issues of this crisis in the next month and years, and we need to think about policies in place to, I won't say resolve that, it's too late, but probably mitigate those risks. I also tend to be optimistic, but this is more systematic-wise, of what opportunities and new ideas this crisis would come up with. And as Churchill say, one should never let the crisis go to waste. So I think, as Dr. Ayadi said, the huge issue of social protection and universal health coverage, and the huge numbers of out-of-pocket payment, which is like, for people who are not like really experts, it's like, I would simplify it by saying people going to poverty because of health expenditure. So someone would be, I would say, above the poverty line, and then one incident or like an injury or a disease, and he will go into poverty. And we estimate this was like 2 to 3% of families in Algeria and Tunisia, and this could be even higher in Morocco. So I think the pandemic opened up the way to meaningful changes that are normally difficult for our highly divided and partisan political institutions. And at least for Tunisia, Algeria, and Morocco, we are back again and trying to think the health care system and the universal health coverage, especially with some incident that happened, unfortunately, in the private sector, where people really delayed their healthcare or even lost their lives because they were not able to afford a private clinic. And those incidents opened again the discussion of the health financing that relies, as I said, on out-of-pocket payment, and that showed that those payments can expose really households to catastrophic health expenditure and impoverish them. We are still waiting for the political and, I would say, public policy institutions to really open the debate on this. But I think for now, the Ministry of Health and other institutions are still in those countries occupied by managing the crisis itself. But I think civil society, international partners, international organization may start this thinking on how we could shape the health system and the social protection and universal health coverage after the crisis. So those are my main points. I don't know if you have another question.
Thank you very much, Mr. Kalbousi. This is very interesting to understand or explain the health system from inside. So thank you for this overview. And now we open up questions for panelists, for also the participants that are right here with us today. So I'll take all the questions coming in, and maybe before taking the questions, I have one question for Professor, if I may. I have a question for Professor Ayadi regarding this study, and it would be whether countries are able to dedicate financial resources to establish these 3-pillar resilience systems that you were proposing.
Thank you, Christina. Well, it depends on the countries. Obviously, all of this depends on the capacity of the countries to dedicate financial resources, and at the same time to mobilize international resources for such a 3-pillar system to work in the healthcare sector. Also, government will have to design a clear roadmap on how to deal with emergency situations when there is a pandemic or there is a major pandemic, like the one of COVID-19. And this also goes beyond the public sector. it also leads us to think that the private sector should also, contribute in a crisis situation and in emergency situations. So in many countries, this has happened in Europe. In the country where I am based, this has happened in Spain. So I think it is important to have a clear approach on how to deal with external shocks like the one we see, especially in the healthcare sector. This is a very serious matter, and it has to be prepared while in advance. Now, specifically in terms of finances, of course, a country like Algeria, we will see the data on the reserves they have, 2020-21, because of the drop of oil prices and so on. They have more capacity to establish all of this, but they need to have the policies in place and the political willingness to do it, just to upgrade, I would say, to modernize the healthcare facilities, to train the doctors, to ensure that they are protected. I think this is extremely important, and also to ensure that they have the necessary tools and the garment and the medication and the protocols and all of this to combat such a situation, such a crisis. A second is also to ensure that the vulnerable populations are dealt with. As in our regions, this is the countries I mentioned, informality is extremely high, and all the cash transfers were not able to target the vulnerable population. So this is why most probably poverty has increased dramatically in some pockets, and we will know the data in the next months, for what has happened. And I think this is a key role for the state, for the government. Okay, unless we are going to rely on the private sector, but for me, the private sector here can contribute. It means that they have to, in emergency situations, they have to contribute. Nobody wins when you have a collapse of the healthcare sector nationally.
Thank you very much, Professor Ayadi. I'll take now questions of the participants. I'll be reading them. So this one is not particularly addressed to anyone, but what were the best practices adopted by governments to overcome the pandemic hit on the healthcare sector, to rely on international aid support, or to give more space to civil society to work hand in hand with their governments? And another question is, which sector of the economy are likely to recover the fastest in the MENA region?
Is this for me again, or for anybody else?
This is not addressed to anyone particularly, but if you want to take it, or Ms. Alia Bayed.
Go ahead, Dr. Ayadi, and I will respond on the economic part, but on the health, if you want.
Of course, there were many practices. Now, are they best or worst? I don't know. There are many practices which I think were dedicated to respond, especially in emergent situations. Like, for example, I can see, for example, in the case of Europe, there has been not a beginning, because everybody was completely under uncertain situations and not knowing what this pandemic is about. But then there were instances where patients were, they took them to fly from one country to another country to be treated. And I think this was a great experience. A great example. Of solidarity in such a pandemic, when it is really taking every country, every government by surprise. I think it is important to have a global platform to learn from experiences of each other. The first country which was hit was China. But then the information came to the world a bit delayed in reality, because in March, some countries have been hit quite hard. One of them is Italy, Spain, and then of course others. So I think it's important for international organizations to get organized to have a global platforms, and they have the capacity to collect all these practices while in advance. And then these global platforms, based on technology, based on digitalization, everybody can access them, are accessible to everybody to know what's going on. For example, I mean, one aspect which, in my view, should have been treated slightly differently, at least more transparently, is the use of protocols, medical protocols. Why there hasn't been an open discussion, global open discussion on the medical protocols that can work, and why they work on a specific moment, the timing of a specific moment, and so on. Why there has been a complete, I would say, opaque debate about all of this. And I think it is important, because this is a public issue, that citizens are aware of what's going on and they can make their minds based on that.
Yeah,
if I may, I mean, just one comment on the role of civil society. And I think civil society has a very important role to play in basically helping to contain the impact of the pandemic and fill sometimes gaps that weak institutions in the public sector or overwhelmed capacities may result in because of not being able to deal with the gravity of the situation. I mean, I can speak about Lebanon, where despite, I mean, the financial crisis, but the role of civil society, for example, and I see there was a question on mental health, for example, in providing assistance and services related to mental health, whether related to the COVID or to dealing with the financial crisis or with other. But you had NGOs specialized in particular type of cares that managed to mobilize funding from the international community, whether grant or from high net worth individual or others, and they were supportive of the action of the government. So yes, I do think that civil society's role in awareness, in I mean, the influencers in society, they can help condition and improve behavior of people. But of course, media has a role, although sometimes misinformation also is very ripe, unfortunately, as we have seen. Now, on the question related to the economic sectors, I think I think there's no one size fits all or one straight answer that this sector can recover. I think what matters is really the conditions in which authorities put in place in order for these sectors to gradually recover. I think what we are seeing, and I was just in the UAE a few days ago, countries that regain credibility, both of their domestic audience and of international investors or tourists, of strict compliance with the rules of certification, will manage to see their sectors, particularly the tourism sector, recover quite quicker than countries who do not create clear protocols for dealing with visitors, for example, let's say. So regulatory credibility and enforcement of rules and regulations related to health measure is essential for the recovery of some sectors exposed. The other thing is those sectors that have moved up the chain of the digitalization. I think sectors that, whether in the commerce area or in high value added services that can provide their services now online, and in countries where the infrastructure for telecom and for logistics is actually very solid, also will be supported for a faster recovery. But there is no doubt that in general, I mean, our outlook for growth in the region for 2021 will remain, I mean, between 1 to 2 to 3%. I mean, maximum we could see a 4% growth somewhere. But again, this recovery will remain uncertain because there is a lot of unknowns that could come up.
Thank you very much, because also they were asking, I think it's responded, but if this pandemic can trigger a much more meaningful focus on investing in other sectors other than tourism to regenerate revenues from the Tunisian government. He was particularly talking about Tunisia, but I think
But yeah. I agree with that, and I think it was very interesting. And last week, the central bank governor of Tunisia was doing a webinar and explaining how the crisis can be actually an opportunity for Tunisia, particularly in digitizing, in moving towards regional, renewable energy and the green economy. Or even really developing the health, the telemedicine and other kinds of health services even further. So there is no doubt that, and even in terms of food security, the point that we are all looking at as a key risk for the region, I think what we are seeing across countries is a more inward focus towards self-sufficiency in the whole supply chain of food production, marketing, and I think that's a big area where we are seeing a reallocation away from trade and some of the volatile sectors to COVID and more towards consumption goods that could be affected by disruption of trade networks.
Thank you very much. I have a question for Mr. Kalboussi. They're asking, what opportunities will emerge out of the current crisis for transforming the healthcare?
Yeah, I mean, as I said, I'm optimistic of the part of collaboration, but not that much optimistic in the part of the political dialogue around the health sector. In matters of collaboration, a lot of international projects are taking place in these weeks and months. One of them in Tunisia is a tracking system, a digital tracking system for medicines, which is, we know medicines is a huge victim of corruption and mismanagement in our countries. So putting this tracking system would at least reduce this mismanagement and corruption of medicines by 30 to 40%, which is equivalent to, I don't know, like 200 million USD, at least in Tunisia. So this is one project that now is starting. The other project is with the engagement of civil society and people outside the health system, like engineers and IT experts. We started to see small but very impactful IT and digital solutions for management of intensive care units, tracking of emergency vehicles. So those kind of initiative, I think the moment is there to really regroup them and really think about them and scale up those pilot projects to have really an impact on the health system. But as I said, those still at the initiative level. I think there is a huge role for the institutions and for the political ecosystem to take those initiatives to another systematic level. And hopefully we will start to see this in the next months.
Thank you, Mr. Kalboussi. We have Amal Karaki, who asked if this study by Professor Ayadi covers the impact of COVID on the displaced person and families.
No, we didn't cover this.
Okay, This is what we thought. Also, I have a question for Ms. Vubayet. Do you actually see some likely political changes due to the bad preparedness of governments in the region? Do you think the socio-economic situation will further drive people on the streets again in the coming years? Maybe it's early to say, but I'll let you answer this question.
No, I think it's an excellent question, to tell you the truth, and I do think that the region did not need COVID to push and accelerate the extent of economic deterioration that some of the countries were undergoing. And when I read the World Bank's assessment about the prospects of the large increase in the number of poor and unemployed, and when I look as an economist looking at the macro picture about the constraints related to the fiscal space and the ability of government to act because their public finances are under stress already, and that lack of reform because of sometimes dysfunctional politics. I mean, I'm Lebanese and I can talk to that very openly, of course, but this we have seen in other countries. I mean, the delayed reforms in Tunisia is a concern for the broader sustainability of its public finances, and therefore the ability of the government to act. So unless we use this shock to accelerate productivity enhancing reforms, and particularly really those reforms that increase competition to allow the private sector to compete and not remain taken hostage by either crony capitalism in many of the societies we live in, or connected business elites to governments, but rather kind of reforms that also allow for the transfer of technology and know-how, whether from nationals of these countries living abroad or foreign investors. So I think if we don't accelerate these reforms, I'm afraid that the demographics in some countries will and the expansion of the extent of poverty could raise considerably social and political risks in many countries in the region. And at the time where we are looking back at 10 years after the Arab Spring, I think we have to be candid in our assessment and look at the failures after a decade in terms of our ability to and our ability of societies as citizens, but also as authorities to live up to the expectations of those aspirations of the Arab Spring, and say what went wrong over the last 10 years and how we can use this COVID in order to avert another bout of social unrest in the region.
Thank you very much for this answer. There are some questions in the chat. I know you're already answering them, but maybe I like to take them so everyone can also listen to your views. So Tunisia has been hailed for having a success strategy, but we should not forget that the country has been without political leadership right before the second wave that has hit the country. While cooperation may be increased, merely increasing the funds will hardly be enough, as the entire infrastructure needs to be reformed and implemented. Don't you think so? This is addressed to Mr. Kalbousi. So what do you believe will be likely focused for healthcare preparedness in the region in the coming years? And this is a question from Malte Gasseling.
Yeah, I mean, yeah, I totally agree on the assessment. If we need to reform the whole system, we would need at least there is an assessment of 3-4 times the national budget of the country just for the health system. But we could be clever, and I think we could be doing something on the issues and the parts of the system where we are losing money. As I said in the previous example, medicines management, infrastructure. I think because of infrastructure, we sadly lost like one doctor who died 2 weeks ago because of lack and mismanagement of technical assistance in our elevators inside the hospitals. So I think there are, if we could tackle them, and human resources also, we could motivate with some financial incentives, but also improving the working environment of our human resources. So those could be the focuses. Also, electronic health records, we lose tremendous amount of time in our where is the patient file. We still use like a paper-based health information system in our hospital. So those could be the priorities that we could tackle with the few upcoming opportunities of international cooperation and aid. But as I said, what needs to be there is the political leadership and the political dialogue around the health system. The focus, I think, for preparedness should be institutional for me. We have I counted 20 institutions only in Tunisia working on prevention in healthcare and health emergency preparedness. And I think it's time for the country to move to something like CDC, Public Health England, Santé Publique France, one, I won't say central, but one major institution with full capacity to take in charge this dossier and to put the country aligned with their recent recommendation in a matter of health preparedness.
Thank you very much. I don't know if any of the participants have any more questions. I don't know if yourself have any questions for each other, because we don't have the chance. We took the questions from participants. I don't know if you have a very last question, because we have 10 more minutes.
I think if I may, it's more a comment, and I think it's extremely interesting just to follow on the question, and since we are at CAS, I think it's extremely important to reflect on what the analysis that study that Dr. Ayadi and the team are doing would mean for and our own assessment of where the economy and the socio-economic dimensions of the COVID pandemic is taking the region, on how this can shape and should shape basically the response in terms of engagement by the international community, and in particular by the European Union. Because I think it is extremly important to realize that an old model of budgetary support to countries like was done at the onset of the Arab Spring was not enough to deal with the vulnerabilities at the socio-economic level, and it is extremely important to reflect on whether the existing mechanisms, modalities, absorption capacity of those countries are in place, and how the COVID crisis would require a reassessment of these modalities of cooperation and response in the Euro-Mediterranean context, but also in the multilateral context for helping these countries overcome the challenges that a post-COVID economy and society would imply.
Thank you. And actually, we have a question regarding this issue, because Maltese Guestlink is asking to Professor Ayadi. Let's try to keep it very, very short. Where do you see an opportunity for the EU and European countries to support countries in the region with regards to the years to come?
Thank you. This is a very good question. I think in the recovery plan, it is important to have the engagement of the European Union, particularly when there is this debate about renewing the economic partnership with these countries. Also, I see also very important role for the EU in externalizing the European Green Deal to these countries, because if you want growth, you better have it green growth. And I think this is a great opportunity to move into this more sustainable model of creation of wealth and employment. So it better be green.
Thank you. I have a very last question. Do you think the vaccine could change any of these scenarios that you've been talking about very, very shortly?
I will not answer this question. I will have to get vaccinated first, and I see what the impact.
I think the vaccine. I could go. I think we are still, at least in my work, we still we already saw the impact of the announcement of the vaccine before even people started to vaccinate. So I think people are already planning, and I see like some institutions here already planning things in June and July, because there is like information that everyone will be vaccinated by April. So I think we should monitor this from the health perspective, but like for the economy, probably it's like a good news. So yeah.
Yeah, the only thing that I would say is that we hope that living on the hope of getting the vaccine should really not prevent those countries would need.
Sorry, Ms. Alia, we missed your point. If you can take it very.
Sorry, I was just saying that as much as having basically clarity over the vaccine and its deployability is essential for anchoring our view about the scenarios for the recovery, whether it could be stronger or not, I think the importance is that the recovery at this stage depends, just to reconfirm my point, on the need not to forego the much needed reforms that the governments need to do in order to ensure that at any point they are ready for a quicker recovery once a vaccine is in place. So living on the hope of a vaccine should not delay these reforms. That's the point.
Thank you. Thank you very much. I don't know if I have time for very last questions that I have here. How will governments address budget crisis resulted from overspending on COVID-19 in the next few years? Just very shortly, because we are running out of time, but if someone could...
Can I give a go on this? Certainly, there will be consequences on indebtedness. So the question is, could be probably solved via reforming the international debt architecture, which has been already put forward by the International Monetary Fund, and hoping that the private sector creditors will be, not only the private sector creditors, but also the public creditors, could sit together and find a solution for over-indebted countries and their capacity to pay back after this crisis hopefully is managed. But this debate has to be open, transparent, and fair for everybody, for all countries.
Yeah, and if I may add also to what Dr. Ayadi said, I think it's important to engage in those discussions, and the region should be at the table. So far, these discussions on the global review of debt architecture has been really targeting those low-income countries. And there is a fact that most of the countries of the regions, their external debt is rather more multilateral, except Lebanon, and Lebanon already defaulted on its debt anyway. But for Tunisia, Morocco, Egypt, external debt is either still low, or where it is high, like in Tunisia, the majority is still in multilateral hand. But that can slip very quickly, and I think you need a combination of improved debt management, but also continued reforms to boost growth while doing the right kind of revenue and expenditure reforms.
Thank you very much. I'll give the floor now to Mr. Thomas Fogg for the final remarks. Thank you.
Yeah, thank you all very much for this very insightful contributions. And I took a lot of notes, actually. We did not only speak about the socio-economic consequences of this global pandemic when it comes to increasing unemployment rates and increasing poverty in many countries in the region. Interestingly, as Mrs. Mubayet said, except of Egypt, where we see a rising economic growth as the only country in North Africa. I think this is also quite interesting to have in mind. We spoke about the health sector consequences, which was very, I think, understandably characterized by Yassin Kalboussi when it comes to the fatigue of the health professionals, something that is very much understandable and that we see all around the world, but also the impact in regard to patients. And I think this is something that is very important to have in mind, that this aspect of patients is always to be considered as well. And of course, we saw the very concrete recommendations, policy recommendations outlined by Professor Ayadi, and I really want to thank again, especially Professor Ayadi and Sarah Ronco for editing this study on the health sector resilience that will be published this week, and that you will then all be able to find on the website of our regional program, but also of the Euro-Mediterranean Economists Association, I think. So one line that was constantly mentioned again is that 2021 will be a crucial year, and I think we are all very much aware of this. It will be the 10th anniversary of the beginning of the Arab uprisings, and with the socio-economic consequences of this pandemic, I think that it will be highly interesting to see how civil state relations across the region will develop, how economic recovery plans will be strengthened, and how especially the young generation will perceive the consequences of this pandemic, and how prospects, opportunities, and real job possibilities, opportunities will be given and created, especially for the young generation in the region. So we will certainly discuss the consequences of COVID-19 also in the coming year. And with this note, I would like to thank, of course, the moderator for this great moderation, Christina Gina, all panelists, Professor Rym Ayadi, and also Sarah Ronco for editing this highly important study, and hope to meet you all in person at some point, and wish you all the best for the rest of this year, and then, of course, for 2021. Thank you very much, and all the best.
Thank you.
Thank you. Bye-bye.
Bye.